Hello, ladies and gentlemen. Um, I'm an OBGYN specialist working in Cairo, Egypt, and I'm a European board certified in obstetrics and gynecology. And now, what we are seeing in the whole world, the spreading of coronavirus has made lots of doctors thinking, are we in a right phase, or are we exaggerating the situation? Are we not seeing the virus clearly and the statistics clearly? We all know that the evidence-based medicine is what we are working through now. And the evidence-based medicine is always about meta-analysis. It's the only thing that we can see it has a validity, like cohort studies, meta-analysis, and the reviews that has to be made in order to tell our patients anything. So I'm gonna tell this video. I'm gonna speak with this video to categories of audiences: the doctors and the patients all around the globe. So you may have heard about the virus, and you may hear that you are protected because you are pregnant and it is not attacking pregnant women. Actually, it is not. It has attacked some of the pregnant women, but for God's sake, and fortunately, there has been no symptoms for their babies. The pregnancy has been passing smoothly, but the data that we have now is still lacking because it's a small number of cases in different places. My talk to the doctors now, we have to do something because in the last few years, everyone is doing researches and sit it. And now anyone who's talking about coronavirus and making any research on coronavirus, it just is spreading so fast in the journals. And everyone in the journals now is taking any research for coronavirus just for because it's coronavirus. And that is misleading completely to the scientific society. We have to think more and more before we talk to people. There's lots of politicians who scared the hell out of people. They scared people a lot. And I know because there is a lots of responsibilities falling on the people who are ruling the countries. And they will be asked one time, what did you do in that pandemic? But this is not the case when we talk scientifically, because what happened that we changed the criteria for diagnosis differently. Starting from the beginning of the disease, now we started to add the CT, and then we said that CT could be misleading because we have lots of patients that they are vulnerable and they have low immunity. They are been in the ICU for different reasons, and they could have co-infection. So that is not really scientific to put that. So we have to stratify all this data after all that happened. After 6 months or later, we have to rethink about our way or criteria for diagnosis until when the every single year that we get this panic attacks for people, because every single year we get panic attacks, and we need to put limitation for that. We have to think clearly because the social media, when you see a video from people in Wuhan just like screaming out of their windows and no one in the streets, and there is lots of screaming everywhere and panic attacks everywhere, you get scared, and that message is spreading hugely. Have we really seen all the patients in the ICU and checked them clearly that they have coronavirus? Did they die from coronavirus? We know that people who's got HIV, they die from pneumocystic carinae. They have co-infection that made them die. Is that the real cause of death? Is the criteria of diagnosis was perfect in those cases? That's why I think that the reporting system now for coronavirus is not really specific. But do we have to take preventative measures? Yes. But the thing is, no system in the whole world can take uh, all that numbers of people who has got pneumonia in their ICUs. That means that you need an army in everywhere to protect your community from doing that. And did we check every year that influenza A has been making lots of death cases around the globe? Is the community now know the difference between both of them? I think we are so much focusing on that. But the general etiquette of keeping nice hygiene, that's something has to be in everywhere. That's not the message that the people are waiting for us. This is not the real message that we need to give. That's something essential on everyday situation. But the thing is, we need to put protocols for disinfection of the incubators in the ICU. We need to think why Italy has been reported that number of cases. Logistically, we have to see that, and scientifically, we has to see this. People are right now talking about different kind of modalities for treatment, and most of us, we know that when you get viral infection, you need to work in a symptomatic way, and some antiviral drugs that has to be tested in a cohort studies or meta-analysis. When you see countries like United States and other big countries that they are the source of science, you see the people who are responsible for that, for the health education and for the people over there, and the politician are just trying to encourage people for different kind of drugs that it has not been studied in the right way. Why in the normal regular time, that in order to say that this drug has to be in a guideline, you take lots of years, and no one will ever believe you, and you still, they will never believe you for like 2 3 years. And then now we are just rushing for to give people a medication that it is not scientifically or evidently based. For the pregnant mothers, or for the mothers who are listening to my video now, I can say that I will take the highest precautions. The Royal College until now didn't didn't say that we can have a cases that has been affected from coronavirus and has been into ICU or incubators for the neonates, and has been taking any medication for that. No reports has been positive for this. So to be more cautious, if you got any kind of high fever, cough, and even diarrhea, or even vomiting, excessive vomiting, and you feel unwell, I feel and I think that logistically you have to be tested. This is number one. Number two, we that your ultrasonographer has to also to think about the effect of any virus. We know that there is a strong viruses can attack the blood of the baby or the fetus, and can get water out of it and make what is called edema, and some of it can kill the baby or your fetus very smoothly and very fast, kind of like something we call a parvovirus. We have different bacteria and viruses that can attack your baby. Most of them, we know that they love to attack the brain, and they love to attack the heart and the development of the fetus. So I think, and those are real viruses, they're strong viruses. So I think to be cautious, you have to be tested by ultrasound to see the fetus if it's normal, and if you have been tested positive. There is debate now whether to do an amniocentesis, is to take samples from the water around the fetus. There is debates about that, because we are living now in an era of debates in medicine, and we approve sometimes the drugs in the protocols, and then after few years you take this drug out and you do not recommend it, and then sometimes you recommend the maneuver, or you recommend using mesh or whatever, and then you take it back. So until this moment, we cannot say that amniocentesis is something that we have to do, and because we didn't do any studies about this. And I'm sure that there is millions of the people who loves research are working now on this, just because they love to do research. And then after 2 3 years, when we do meta-analysis and then come back to our practice reality, and then we start to talk in realistic, we will review what we are saying now. So my own advice is to really become so cautious, and to be on the phase of watch and see safely, and do all the precautions to protect the mothers. Please, you have to know that increasing or having high temp is something that we know it is harmful for pregnancy. So when you get a high temperature, you are more prone that you could get preterm labor. You could get that. And you could get something what we call a co-infection, which is you get a bacteria on top of the virus, and at this time that's theoretical, and at this time you are more prone to pneumonia and to be admitted in the ICU. We know that there is real viruses like varicella viruses and herpes viruses. Those can attack women, and those can make severe effect or big effect on their lungs. So for every now and then, I will be trying to update you and think. I hope that I can find some of my colleagues around the globe who are having the same message, and we can get together in the time when everyone now would like to show off in the scientific society in sending researches that it is not until this moment that we can give a conclusive message to our patients. And all the guidelines that is coming is just like stay home, wash your hands, stay home, wash your hands. That's not what the society is waiting from us. That's not what the society is waiting for us. um, I hope I delivered my message clearly, and I'll be updating you every now and then. Thank you so much.